Hello students, welcome back to the PhysioBrid series with me Divya Gupta. In this video, I am going to demonstrate accessory movements at the inferior radioulnar joint. Accessory movements refer to movements that happen between joint surfaces and are necessary for normal joint function, but they may be absent or reduced in pathological joint conditions. These include gliding and rotational movements which cannot be performed in isolation as a voluntary movement, but these can be isolated by a physiotherapist. In clinical scenarios, accessory movements are used in joint mobilization or mobilization with movement to improve range of motion, which in turn can help reduce pain and improve function. The distal radioulnar joint is a pivot type of synovial joint with articulations between the ulnar notch of the distal radius and the head of ulna. The head of ulna moves relatively backwards on the radius for pronation and forwards for supination. The patient is relaxed and in sitting or supine lying position. Here we have Mr. Ajay, who is in a sitting position. So the patient is sitting with the elbow flexed and the forearm supported on the treatment table. Place a towel under the patient's wrist and hand so that the joint is supported. The therapist stands beside the treatment table facing the patient. The joint is placed in 10 degrees of supination, which is the open packed position because the movement is free in the middle range. One hand stabilizes the distal radius. Do that by placing your fingers on the dorsal aspect and using your thenar eminence and the thumb on the volar aspect. In a similar manner, grasp the distal ulna with the other hand. Glide the distal ulna volarly, that is posterior to anterior, to increase supination. Glide it dorsally, that is anterior to posterior, to increase pronation. In this video, we learnt how to perform accessory movements at the inferior radioulnar joint. Stay tuned for many more videos coming up on exercise therapy, and do leave your comments on what else do you want to learn.